Hello, today I'd like to walk you through a basic shoulder examination so that you can feel empowered the next time you visit your clinician to discuss shoulder pain. With any examination, the clinician should first rule out more serious problems, and this includes a shoulder fracture. If a person has undergone a recent trauma or fall under their shoulder resulting in bruising, swelling, and constant shoulder pain, this could be a fracture requiring an X-ray to rule out. A spinal cord injury can also present as an issue with the shoulder if a person has no pain but the complete inability to raise their arm, while another person can passively range their arm in all directions. And a spinal cord injury would require further testing to rule out. Once these serious problems have been ruled out, a clinician could proceed by screening the neck or cervical spine for a disc bulge or arthritis that may be referring pain to the shoulder, tricking patients into thinking they have shoulder pain when it's actually an issue at their neck. A clinician should have the patient look down 10 times, look up 10 times, and look to the left and right 10 times while asking the question, is the shoulder pain better, worse, or the same? If these neck motions change the pain to the shoulder, this could mean that it's not a shoulder issue, it's actually an issue at the neck. Once this has been ruled out, a clinician can proceed with the actual examination of the shoulder joint. And for this, it's important to have a good knowledge of active versus passive motion. Active motion is when a person moves their arm on their own. And passive motion is when the arm is completely relaxed and somebody else moves the arm. The clinician could have the patient turn their thumb down and raise their arm in front of them as high as they're able to. If a person has full range of motion, but they feel a bit of discomfort towards the end of this motion, this could mean they have shoulder impingement or pinching within the joint. Shoulder impingement is also painful with what's called the Hawkins-Kennedy test, which involves this motion and pressing down on the forearm. If the person can only raise their arm to a point, but the clinician can passively move their arm higher, this could indicate a rotator cuff injury. The rotator cuff is comprised of 4 different muscles, so an injury to a muscle will only limit active range of motion because that requires a muscle contraction. 90% of the time, the rotator cuff muscle that's involved is called the supraspinatus, and it's most painful by raising the arm up with the thumb turned down. The infraspinatus could also be injured, which is involved with external rotation or the hinging out of the shoulder. And the subscapularis could also be injured, which would be painful if you place the hand on the opposite shoulder and push down. Once again, rotator cuff injuries present with limited active range of motion, where passive range of motion is better than the active motion. If a person is unable to raise their arm all the way actively, but passively they also demonstrate a limited motion, this could indicate arthritis or frozen shoulder. Frozen shoulder is more common in women of the age 45 to 60 who have underlying diabetes, rheumatoid arthritis, or a thyroid issue. However, those are only trends, and it can present in anyone. Arthritis is more common in the older population, and it feels like a toothache within the joint, and it's often worse in colder weather. Once again, arthritis and frozen shoulder demonstrate limited active and passive range of motion. So the person would only be able to raise their arm to a point, and passively, they wouldn't get much further than that. Lastly, I'd like to discuss labral tears in the shoulder. There's some research to show that physical examination and imaging, including MRIs, are not accurate in diagnosing a labral tear as the source of pain in a shoulder. However, as long as the shoulder is not repetitively dislocating out of the socket, it may respond to conservative care. And many of the conditions discussed during this basic examination may also respond to conservative care in my shoulder pain protocol. However, prior to starting any rehab regimen, it's important that you consult your doctor. Visit ptrehabdoc.com to find therapeutic workouts for the shoulder, neck, low back, hips, knees, and full body. And remember, if you're going to work out, do it in a way that helps you gain strength without sacrificing the health of your joints.